A health alert for parents with school-age children or those in childcare. Wisconsin has updated its immunization requirements effective immediately for childcare centers. It also takes effect for school attendance in the fall. The meningitis vaccine will now be required for students entering 7th grade and a booster dose for eligible students entering 12th grade. Children must also now have a diagnosis of chickenpox come from a qualified healthcare provider, not a parent, to be exempted from the chickenpox vaccine requirement. The previously established list of required vaccinations are still in place, as are the existing exemption options for medical, religious, or personal conviction reasons. There is no requirement for seasonal flu vaccination or COVID-19 vaccination, although these remain strongly recommended by leading health experts.